Dumelang, welcome to Face the Nation. My name is Clement Manyatela. Great to have you with us here on SABC News. On the show tonight, what is the health and police departments doing to stop Operation Dudula from continuing with their campaign to block foreign nationals from accessing healthcare? The group says it's engaged in this campaign because South Africans are being affected by the systematic issues in our healthcare system, which they believe are being worsened by illegal immigrants. We speak to both Operation Dudula and the health department. Also on the show, does the Gauteng government have the capacity to deal with organized crime? One of the KZN commissioner's allegations is that there is seemingly a powerful criminal syndicate operating in this province involving prosecutors, business people, the judiciary and law enforcement members. Gauteng Premier Panyaza Lesufi will speak to us. And then later, there's a tragic incident that happened recently in Germiston where a 68-year-old woman drove over a group of young ladies who were part of a coming-of-age traditional ceremony, killing 13-year-old Pretty Mahlangu and injuring others. It's alleged that this disgruntled neighbor of this hosting family took issue with what she allegedly labeled as revealing traditional Zulu attire. So according to witnesses, this woman just drove her car into the crowd of these young girls, refusing to wait while they make way for her. She presented herself to the police and was released on the same day when this incident happened. Now the police are saying a new warrant of arrest has been issued against her. We'll speak to the family spokesperson tonight. But first, my comment. So Operation Dudula marched to the Human Rights Commission today, describing their rights, the rights group as unpatriotic for protecting illegal foreigners at the expense of South Africans. The group has been on a campaign across the country, blocking foreign nationals from accessing clinics and I believe some hospitals as well. And in fact, this is not new because they've done it before in recent time, and it didn't just start now or over the last couple of months. Here's the group's explaining really why they have been pushing for this particular campaign. This was during their march earlier today.
The reason why we're here is we were delivering a memorandum of demand because we strongly believe that South Africa Human Rights Commission should be for South Africans, but we are seeing the opposite. They're prioritizing foreigners over us South Africans. I mean, we just gave them 2 cases as a starting point. That there are cases that have been reported to them by South Africans, but they do not even respond. But when it comes to foreigners, they are quick to respond. So we gave them 10 days to respond to our demands. One of our demands is that they need to make sure that the people that were evicted from their homes are reinstated back into their homes. And others, they need to go to the township, call communities, try and find out what are the issues with them and foreign nationals, because we are representing the communities, but we'd like them to hear it from the horse's mouth and rather from hearing it from us.
Now, there are instances where we have seen, well, at least from what we've seen in reports, that babies have been blocked from even getting vaccines as part of this operation, where Operation Dudula even controls some clinic queues, chasing away immigrants or telling them to stand separately from South Africans. This is what's been reported so far. Now, there are 2 issues here that are important to consider. The first is that what this group is doing is illegal. There was a court ruling, in fact, in 2023 that said mothers and babies are entitled to free healthcare regardless of their nationality or immigration status. But also, access to healthcare is a constitutional right in South Africa and is available to all who need it, regardless of their status in the country. So as much as their concerns can be legitimate, infringing on people's rights to access healthcare. Section 27 of the Constitution entitles everyone access to basic healthcare services. The second issue I think we need to consider is the issue that this group raises, even though they are raising the issue through illegal means. the issue of access to healthcare system and how ineffective it is. I mean, the group believes that the healthcare system is overburdened by foreign nationals. But the health minister has said before that the department did not officially collect this data. But you still have immigrants being blamed for broader systematic problems with the health system, even though health experts have said that the impact of immigrants on the health system is very little. So what is the health department's plan to address the systematic issues? And that's a conversation we're hoping we can have with them tonight. But here's the South African Human Rights Commission explaining the illegality of the group's actions.
Should we not address and provide medical health care to everyone? Issues such as HIV will not be addressed, and TB, which are the most problematic issues in South Africa. So we will see an increase in that. And the issue is then we really need all governments, and specifically in the SADC region, to have a conversation about access to healthcare in South Africa and how do we then navigate and answer that so that we don't have vulnerable members of the community battling it out for limited resources at hospitals.
Now, the Department of Health has since called on clinics to inform the police when this protest action happens or when the group members are blocking people from accessing health care. But there are questions about whether this has actually happened. So the question we're asking you tonight is, how do you think our government should deal with the systematic issues in our healthcare system? Does the answer really lie with controlling foreign nationals' access to health care? How do you think government can address this anti-foreigner sentiment and ensure equitable access to health care for all individuals, regardless of their nationality? You can send us a WhatsApp voice note on 078-459-1897 to share your thoughts with us. Remember to tell us your name and your surname and where you are sending that voice note from. Alternatively, you can send us an X on @FaceTheNation SABC. We'll be back after the break. Welcome back. Now, let's stay with that story around Operation Dudula and, of course, the health department's response. We start this conversation now with Foster Mohale, who is the spokesperson for the Department of Health. Foster, thank you so much for joining us. Good evening.
Clement, and good evening to your viewers at home, and thanks for this opportunity.
What's been your position as the health department? I know previously you have tried to warn Operation Dudula from continuing with this campaign. From what you observed so far, what's been happening? Are they listening? And what's your next plan as the Department of Health?
Yeah, no, definitely. As the Department of Health, we've discouraged individuals and organized groups like Operation Dudula who go around at our health facilities demanding to see any form of identity from the healthcare user. We discourage that, even though we understand the concerns. So they are raising valid concerns, but through illegal means, which is a challenge. So we understand the burden of created by undocumented foreign nationals on our healthcare system. But we want to encourage anyone with concerns to raise their concerns through a legal means, but also proposing solutions to address this issue on a long term, because we strongly believe that this is a societal issue. It's not only about health. You can imagine the undocumented national or citizens in the country who commit crime. It's going to be difficult for our law enforcement agencies to trace them because they are undocumented. But with regards to access to healthcare, you correctly quoted the Constitution of the country, especially Section 27, also supported by the National Health Act and other pieces of legislation, which says we cannot deny anyone access to health purely because of their immigration status or their nationality for a number of reasons. For example, just yesterday, we have issued a media statement to update the public with regards to Mpox, the outbreak of Mpox in the country. And majority of these cases are imported cases, meaning that they they were imported from countries or regions where currently they are dealing with the outbreak of this disease. The same applies to COVID-19, the same applies to measles and so forth. And you will never know who is the carrier of which virus. So if we start discriminating against the healthcare users based on their nationality, all our efforts to prevent the spread of these infectious and deadly diseases will be we will not succeed. So hence we say, let's try to address the root cause, which is not health. So let's try to identify the root cause and also deal with that root cause. We'll be able to prevent a lot of the challenges.
Yeah. So when you say that you do understand as the health department the concerns that they're raising, albeit doing so illegally, the issue of foreign nationals and the impact that immigrants have on our healthcare system. Do you have that kind of data? Are you able to state that you're aware that there are pockets where particularly illegal immigrants are overburdening the healthcare system?
No, definitely we are well aware. Remember when the Minister of Finance, they allocate the budget. They allocate budget based on the population size of the country, and as the Minister of Health also further allocate the budget to provinces based on the population of the provinces. The same way the MECs, the premiers, the MECs, they also do the same. So I'm just giving an example. Let's say health facilities which are located around Musina, obviously they know the population size which is documented in Home Affairs and also Stats SA, how many people are living in that particular area. So when we allocate the resources, the number of the nurses, the number of other healthcare workers, but also the infrastructure and also the treatment, we allocate based on the size of population so that we are trying to meet the ratio. So unfortunately, you will plan for example, let's say around Musina, the population according to Stats SA is about 2 million. So obviously, we will plan our resources according to the official size of the population, but we end up seeing influx. We end up saving more healthcare users than the documented one, but because of the laws of the country, we cannot discriminate against anyone. So
what do you say then to someone who, because part of what this group is raising is that you've got some South African citizens who try to go to a clinic, who try to go to a hospital, and sometimes there's just no beds because of that overburdening that you are speaking about. And yes, there's no justification of the actions by this group, but I mean, you surely understand the frustration on the citizens of this country if they go to a hospital or they go to a clinic and they are not able to get assistance there because the system is overburdened by illegal foreigners.
Absolutely correct. That is a fact. But I know at some point previously the government tried to engage the embassies of a number of countries whose citizens are currently in the country to say, please, can you meet us halfway, try to settle some of the bills for some of your citizens? But unfortunately, they asked us the difficult question which could not answer, to say they are not aware of the presence of their citizens because they did not leave their countries legally, meaning that it's going to be difficult for them to account for anyone who claims to come from the country if they are here illegal. So that is a conundrum, but we want to appeal to members of the public, individuals, organized groups to say, please, let's try to identify the root cause of this instead of dealing with
But we already know the root cause. We do know the root cause. We already know the root cause. So what are we trying to identify? You've just indicated that there are people who are coming into the country illegally. Even their own governments are not able to identify them. When they are here illegally, they end up using our services because our laws and our constitution allow for that. Isn't that where the issue is? So when you say let's identify it, what do you mean?
No, look, I don't think that could be one. Look, firstly, the fact that they entered the country illegally, they committed a crime in the country. Do you agree with me?
Yes,
so
I
meaning
do.
that yes, meaning that the law enforcement agencies must enforce the law and act without a bias. So they need to enforce the law and arrest anyone. So they committed the crime. So they must be arrested and deported. So hence we say, Clement, if you know that your neighbor Foster is here, or you suspect that Foster, your neighbor, is here in the country illegally, what stops you from calling the law enforcement agency? What stops you from calling the immigration officers to come and interrogate Foster? And if I cannot provide any proof that I'm here in the country legally, then I must be deported.
Yeah, and Foster, I mean, you know how the system in this country is. I bet you there are many people who have probably tried that approach before. And part of the problem, which Home Affairs has admitted to, is the corruption in the system. So yes, you call that immigration officer, but they get given money and they walk away and nothing really happens. And look, I'm not trying to hold you accountable here for issue of our porous borders. Yes. That's not your department. You are the health department. But I'm trying to indicate that as government, you have completely failed to manage the borders, because now we're sitting with a situation where citizens are frustrated because they are unable, some of them, to get healthcare services because our healthcare system is overburdened by illegal immigrants. And all we're hearing is, oh, we need to go fix our borders, which is a promise that's been made for so long. So that's going to make it difficult for you then to have conversations with citizens who are frustrated, because they'll say to you, you've been promising to fix this and you're still not fixing it.
No, definitely. And just to give an example to say this is a societal issue. Look, someone can also argue that their children are not able to get the space in the local schools because now they have to compete with the children of undocumented foreign parents. So that is, hence I say this is a societal issue that must be dealt with holistically, not in a piecemeal. Exactly, you have pointed one of the contributing factors, the issue of corruption. So if we can try to address the issue of corruption and other contributing factors, definitely this issue will be able to address this issue once and for all.
Is there an expectation that when you are a foreign national or you are here illegally, there's supposed to be some payment of sorts that you have to make when you are getting health care, even in public hospitals? Can you clarify that for us? Because part of what we're hearing being reported is that this group sometimes wants to ensure, I don't know how they go about ensuring that, that there's some form of payment that's made at these clinics or these hospitals when it's foreign nationals that are consulting.
Yeah, no, according to the public health system in the country, the healthcare service at the primary level, meaning that at the clinic and community healthcare, is free of charge for anyone, regardless of their regardless of their migration status. Then at the higher level, the hospital level, it is not free for anyone, whether South Africans or whether foreign nationals, except for the following categories: pensioners, number two, number two, pregnant women, number three, children under the age of 5. So it's free for those 3 categories, but anyone is supposed to pay, and the cost is determined by what we call the means test. So your affordability, we check your affordability, then we're able to charge the price. But you know that in the public health sector, our priority is to save lives, unlike in private sector, where before they can even open a file, you need to put money, you need to show any form of a financial commitment that will be able to afford the healthcare. But in public health sector, we prioritize your health, then we can sort out the issue of settling the bill afterwards. And that's where we find that some of these people are unable to afford not only foreign nationals, but also South Africans because of the level of unemployment.
Yeah. All right. Foster Mohale, let me thank you. He's a spokesperson for the Department of Health. I mean, the fact that today we still don't have a government that's indicating to us what they are doing that is effective on the ground in as far as managing our porous borders, that's going to be a serious problem for us. In fact, if you've heard the minister in the presidency in Parliament just the other day, and you read the redacted national security strategy, that warns that uncontrolled movement of refugees and asylum seekers can trigger, among others, acts of terror. And yet we still have a government that's been making the same promise for decades now. And we're still not seeing the effect. And when you've got groups like Operation Dudula that come up and are raising these legitimate issues, albeit you could argue in illegal ways, then you wonder what the issue is. So as soon as government really addresses this, the sooner the better. Otherwise, things may potentially go worse, as this redacted national security strategy warns us. Let's bring in Zandile Dabula now, who's the Operation Dudula's president, who joins us now on the line. Zandile, thank you so much for making time for us. So the health department, as I've just spoken to them, they seem to be admitting that, yes, illegal immigrants are overburdening the system, but they're taking issue with how you are going about raising your concerns, where you're blocking people from accessing health, which then infringes on their rights.
Good evening, Clement. Thank you so much for having us. I've been listening to Mr. Mohale and how they're trying to justify, our government officials have been exposed. They've lied to the citizens of this country for many years. Corruption is now catching up on them. Firstly, he talks about how they're trying to manage the situation of medication and all that. That's a lie. We know that non-South Africans steal the medication and go and sell it back home. We've seen it. There are articles to prove that. Now, there is no political will, Clement, when dealing with this immigration issue. They keep blaming each other. When you talk to immigration, they tell you that they need police to be involved. When you talk to police, they tell you that, no, we actually need immigration to be part of us, but you will not find them working together. I mean, it's been almost 3 weeks now. We've been stationed at healthcare facilities. Why is it that we don't see immigration and police coming to take over in what we are doing? I was listening to the MEC of Health lying to South Africans, I think this morning, or was it yesterday morning, saying that each facility has a fingerprint to trace where people are coming from if they don't have documents at that time. That's a lie. They don't know how to measure illegal migrants, because clearly you can't measure illegal migrants because they come here illegally and there's no way to show how many of them are here. So they must not, you know what, I think they must just go sit around the table and just make sure that they close the borders, because yes, the porous borders is the main issue here, but even themselves, if we had immigration officers stationed at healthcare facilities, then we wouldn't have this mess. If people were made sure that they receive medication, they are not turned away because foreign nationals are being prioritized, then we shouldn't be having this problem. But, I mean, unfortunately, we're dealing with politicians who are now big-headed. They don't listen to what people want, and this is exactly where we find ourselves. Yeah,
so how do you then marry your actions versus what the Constitution says? Because as legitimate as your concerns are, our Constitution does say that everybody has access to healthcare regardless of their status. So when you are going to these hospitals and clinics, what gives you the authority to interrupt with some of the foreign nationals accessing that healthcare?
So, Clement, and I've said this before, that this Constitution must not be interpreted. When the Constitution was drafted, it was just after apartheid. And it talked, when it says all who lives in it, it talks about the excluded, the exclusion of black, Indian, and coloreds. So after everything, the diversities and all that, the Constitution was then drafted to accommodate them. No country will draft a Constitution to prioritize, or rather not prioritize, to cater for illegal migrants. Now, the Section 27 talks about everyone has the right to health, education, food and all that. Now, they are clinging on that, but there's also subsection 2 that says when there is available resources. Yes, we don't mind sharing with them if there is available, but currently we are battling ourselves as South Africans. There's not enough for us South Africans, and we cannot be catering for illegal migrants. I mean, these people are criminals. Now, what we are asking from these departments is that if it is an emergency, they can get help, let them be treated, but after that, they must be handed over to the law enforcers. And if they really don't have documents, then they must be deported. But if they have documents, then they must pay for the services, because, I mean, every department has its budget. If, for instance, Gauteng, a Department of Health has a budget for 10 million people, but we are now probably 15 million. Where is the budget for the 5 million going to come from? Those are the other factors that, the likes of these NGOs do not looked into. That's the same reason why people will be sent back home, because there's no medication. And, why should we always worry about people coming from their countries, leaving their issues and not fixing them, coming to our country and burdening our systems? I mean, I'm going to make an example with a child who's asthmatic. If the child needs a pump, gets to the hospital, there are no pumps. But there is a bus going to Zimbabwe with 1,000 pumps. Is that fair for us as South Africans?
So, I mean,
I don't think so.
Yeah, and I mean, Zandile, anyone in their right mind wouldn't really disagree with the issues that you are raising. I think there's a legitimate concern about illegal immigration in this country. As a global of a phenomena as it is, the way that we've managed it in this country leaves much to be desired. I suppose there are differences about how you are going about trying to ensure that South Africans are prioritized. For instance, take young children who want to be vaccinated. Some of the reports are suggesting that your members have even been blocking parents who are bringing children who need to be vaccinated.
Now, Clement, remember when you come to this country and you are documented, your visa will come with a medical insurance. Now, this means you are able to pay for the services that you will be getting at the healthcare facilities. Now, this is just proof that these people are undocumented. And if really they want their kids to be receiving immunization, there are private hospitals. They must go and pay for them. What are they here to do in the country? Because we know these illegal migrants. Some of them are working, some of them are running businesses. Yes, it's others are running spaza shops. Some of them are just in informal trading. They have money. Why are they not paying?
And not all of them have the money, though, to access private hospitals or private doctors. And how do you measure which one has money and which one doesn't?
So that's the thing, that not even our government can cater for us as South Africans. Now, why do we have to prioritize foreigners over it? It's not fair for us as South Africans. All we are asking is that South Africans need to be prioritized. Let the government deal with this current situation. Let them go and talk to different countries, the leaders of the countries. If they want to accommodate them here, then they must pay for it. But we can't be accommodating everyone is uniting in South Africa. It's not fair for us as a country. I mean, the unemployment rate is high. Kids are not accommodated at school because the people that are in those schools are non-South Africans. And we can't just reduce it to the fact that we hate migrants and we are inhuman, we are xenophobic. That's not the case. And yes, I know you're going to ask me the question that where do we get the authority to do this? We as the citizens of this country, we care, and we can see that the people that are supposed to be leading us are doing nothing about it. Have you ever heard the president of this country addressing the issue of illegal migrants rather than just telling the people that Operation Dudula is a vigilante group? He has never said anything. So there's no political will. And unfortunately, if they continue to ignore this, we're sitting on a ticking time bomb that will explode anytime soon, because South Africans are just angry. We need leaders that will lead us and not leaders that will be reacting when situations are bad. Can they do something about this situation? Because in the near future, nobody will control it, not even ourselves as Operation Dudula, because it looks like ordinary South Africans, not even members and supporters of Operation Dudula, are supporting the programs that we are doing in and around our country.
All right, Mzwandile Dabula, let me thank you for making time for us. She's Operation Dudula's president. Earlier on, we spoke to Foster Mohale as well. As I said, all of us probably just agree with the issues that they're raising. It's the manner with which they are raising it that is of concern. It is illegal to be blocking anyone, whether they are here legally or they are here illegally, from getting medical health care. Section 27 is very clear on that. Everybody is entitled to basic free health care. If you don't like that, then maybe vote for a party or start an organization that's not going to put the spirit of the Constitution in the forefront. But as things stand now in this country, we all are obligated to respect the rule of law. And as it currently stands, you can't stop these people from accessing medical health care, as concerned as you may be about how overburdened our our healthcare system is. Let's look at some of your tweets now that have come through. We've been asking you this question of how you think government can address this the anti-foreigner sentiment and ensure equitable access to health care for all individuals, regardless of nationality. Because we also can't have a government that's consistently trying to say, stop doing this, it's illegal, and yet they are not also fixing the issue of illegal immigration. Mohale on Twitter says, the government must collaborate with neighboring countries to improve healthcare systems regionally, reducing cross-border healthcare, seeking and easing pressure on South Africa's system. Mohale, thank you so much for that tweet. Foster Mohale was telling us that they've tried to engage with some ambassadors of other countries, and there's just no interest because those countries are telling them, we also don't know these people that are supposedly in South Africa illegally. Another one says, hi Clement, one starts by being compliant to hosting countries' immigration laws before enjoying the benefits that come with his or her legal status. If the access is guaranteed to healthcare facilities, then mediclinics, etc. are open. They can access it there too. SA, enforce laws. Oile says, I for one don't understand this issue of marginalizing other groups. Health is a universal human rights matter, and we need to remember this fact that many South Africans right now are in many African countries in the world. Sitini Ngabo, that's a question that Xolile is asking. Khutso says, secure our borders and deport anyone who is in the country illegally. And yeah, that's a legitimate question to ask, Khutso. But how long has government been asked to do exactly that? And yes, we're seeing some implementations of some policies from the past. We know what's happening at our borders now with an organization that's been formed to try and facilitate the operations there and ensure that there is no corruption that we've seen over the years. But the fruits of that probably are still coming. Here's a voice note that's also come through.
Good evening. My name is Kagiso Moses Moka here in Mafikeng. Well, what I believe is that the government must deport illegal foreigners to their countries, and those who are legally here in South Africa must have equal access to health care. I thank you.
Sam Alekotriko Bislemen Dumela. For as long as foreign nationals are in the country illegally, we are going to have a big problem. With South Africa's ailing economy, Trump's inflated tariffs, the Department of Health has no choice but to succumb to the call made by Dudula. However, it is against our culture that we must practice self-hate at this moment. Bye-bye.
Thank you so much for your input. We'll be back after the break. Welcome back. The family of a teen girl killed at a coming-of-age ceremony is seeking justice. A 68-year-old woman is accused of driving into a group of girls during an Umhlonyane, a coming-of-age celebration in Germiston in Ekurhuleni, killing a 13-year-old girl. Police have confirmed that a case of culpable homicide was opened. However, the suspect was arrested and then released, and then the matter was not enrolled. The court has now, we understand, issued a new warrant of arrest for the suspect who is due to appear in court. Mzwandile Soyaya speaks on behalf of this family. Mzwandile, thank you for making time for us. And once again, condolences to you as the family for what happened there. What are you able to share with us so far? What have the police told you?
Good evening. Thank you for the opportunity that is given to the Mahlangu family to express their challenges that they have faced in regards with the matter. What's happening is that since the matter, we were told that it was not placed on the roll, we We understand that a warrant of arrest has been issued. We only got to learn that from the media. And now I went in today to speak to Colonel Mahlangu, the one who's the investigating officer. Then he told me that he will contact the family tomorrow to give further instruction. However, before the sunset, I received a call from another journalist informing me that the matter has been put back on the roll, and that will only be happening tomorrow. So which means we have strong possibility that she will be appearing at the court tomorrow. But that has not yet been confirmed by the investigating officer.
Okay. And then for some of our viewers that may not be up to speed with what happened, my understanding here is that you had a ceremony, a traditional ceremony as a family, and you did warn your neighbors about it, but there's this particular neighbor who took issue with how the young women were dressed. Can you explain to us what kind of issues she raised and what happened when her car approached the group? Was she being blocked from passing and driving through the road? What happened? Why did she end up just ramping through the crowd?
Okay, what transpired is that the kids were invited to a ceremony in Dinwidi, Umhlonyane. So when they were there, they first took a parade around the block to notify the neighbors, I would say, of their presence. So now what transpired is that indeed 3 cars actually tried to pass through to that crowd. But 2, they managed to turn them back. Then her car, she did not want to stop, as it's seen from the video that she rammed on somebody else. When she rammed on that individual, then she went through to the crowd of the kids.
Geez, and that's when now Pretty, who's a 13-year-old, then was killed in that process. So the other cars that were turned around, was there an alternative route that they could use, and was that communicated in advance?
When they were turned around to try and use another route. Yes, we understand from the community group of that area that it was announced that from this time to that time, people mustn't use that road because there will be a ceremony that will be taking place. And we also got calls from various individuals from that area who said, yes, we can attest to that because it's in our community group.
Okay, so from the people then who witnessed what happened, what do they think was the driving force behind this woman's actions? My understanding is that earlier on in the day, she had raised issues with how people were dressed. She feels, why are young women naked on the road when they were wearing their own traditional attire? Did she have issues with that? And from the witnesses, what are they saying about how this woman behaved? Do they think that this was a deliberate act?
From our understanding is that at first we would take it as if she was like inquiring like anybody who would be wanting to know what's going on. So they explained, but then she said, how can your families allow you to walk like this? Where are your parents and all of that? That one, they managed to explain it to her. It seemed as if she understood what was going on. But now, as for the fact why now she went back for the second time to try and pass through, that is what is puzzling everybody at the present moment. And after she was tried to be stopped from the first time, she then just drove over the kids and managed to knock down Pretty. When she was asked, she said that to the police that she was running away. She felt that she was being attacked by the kids.
But the video doesn't even indicate so. I mean, when you look at the video, you can see that it looks like she was being diverted to an alternative route. She didn't come speeding. In fact, the car had stopped at some point, and then she decided to then accelerate.
That's quite correct. The car, if you've looked at the video, it stopped a bit. Then eventually it started to pick up momentum, showing that she was defying whatever that she was being told, in terms of turning around, of which now, from also what we gather from the family where the ceremony was, they are saying it's not for the first time this lady is behaving like this whenever they are having ceremonies.
So what options are you considering as the family? You have been frustrated by the lack of communication from the SAPS. I mean, the manner with which they've handled this issue from the beginning, the fact that this woman presented herself but was released, the matter wasn't enrolled. What are you considering next? Are you perhaps hoping to see what happens tomorrow and you'll take it from there? And what do you make of how this matter was handled from the day that this tragic incident happened?
I believe, I'm sorry to say this, but I think it's only fair for us of what as a family we are feeling. We feel that this has got to seriously do with the race, to be quite honest with you. Imagine a scenario where if it was me or you who've bumped someone of a different race, surely, you know, the wheels would have turned in another manner. But in this instance, as a family, we feel as if she squashed like a bug or, you know, a cockroach. So there is nothing that is going to be done with her. Because when we also check with the investigating officers and all, from day one, on Saturday, when we went with Pretty's mother there at Germiston Police Station, we were told that we are interfering with the investigation.
Yeah. Mzwandile Soyaya, thank you so much for speaking to us. He speaks on behalf of the family. I really appreciate your time and all the best with this issue going forward. Hopefully the police will be able to take you into their confidence and consistently keep you abreast with what is happening. We'll be back after the break.
Confirmed that a case of culpable homicide was opened at Germiston Police Station, and the suspect was arrested and released on bail by the court prosecutor to appear before court the following day. The following day, she went to court, but the matter was not enrolled. However, the court gave instructions to the investigating officer to gather more information and evidence. The investigation was completed yesterday, and the court has now issued a warrant of arrest for the suspect.
Welcome back. Gauteng Premier Panyaza Lesufi has pledged the province's cooperation with the Judicial Commission of Inquiry probing alleged political interferences in police investigations. Lesufi says that his government will not let these claims go unaddressed following explosive allegations by KZN Provincial Commissioner Nhlanhla Mkhwanazi implicating top SAPS officials. You'll remember Gauteng, Metros, Tshwane, Ekurhuleni and Johannesburg were identified by the president when he announced the inquiry. The Premier joins us now in studio. Premier, thank you for making time. Good evening.
Thank you so much, Madimecha.
So you've just come back from the legislature. You were presenting your budget. It's been passed now.
Yeah, it's been passed. 54 votes supported. Only 22 didn't support the votes. But it's an overwhelming majority. And it goes against the views of those that said we are running a minority government when we established it. But I'm grateful to all the political parties that supported us, and we don't take their support for granted. Now we have a budget fully supported by the legislature, so we can continue to implement and prepare mainly, especially the G20 Heads of Summit that is coming here in our province.
Well, one of the things that were also central to your budget is how you're going to be addressing the issue of crime. The Provincial Commissioner in KwaZulu-Natal says their investigators have identified a criminal syndicate of sorts that exists in the province. Were you aware of that? Were law enforcement agencies aware?
Surely not. We're taken aback, but we appreciate that he came publicly, and I want to thank also the President for appointing the Commission of Inquiry so that all those that have those kind of allegations can go to the Commission and ventilate their accusations. What is important from us, and I said it to the Provincial Commissioner, that we have to cooperate, but most importantly, prepare so that if there is any information, we'll rather volunteer that information rather than have the difficulties of explaining to information that we don't know. So the team has assured me that they will be in a position to prepare for that commission. But we meet every Tuesday as Ekurhuleni, Tshwane, all our municipalities and the SAPS. So it's going to be very easy to prepare. But we are grateful for the opportunity, and I know South Africans are looking for answers. And I really believe that we should prepare so that we can respond to those allegations. Yeah,
but did the police know about these criminal syndicates or cartels operating in the province?
Well, we knew. Remember, when I addressed citizens of Gauteng around February, I explicitly said we are following 450 people that we know are responsible for crime in Gauteng, especially within the kidnapping syndicate, the drug syndicate, the CIT, and those that are hired to kill people, and the organized crime in terms of stealing certain things, especially state installations, which can be copper, as well as the Zamazama. So we had 450 people that we profiled, and we profiled them on the basis of either they've skipped bail, or they are frequently arrested, or they are on parole, or we know that they are part of a syndicate. So we're using some sophisticated technology to determine their movements. And out of the 450 that we said were tracking, 123, we managed to arrest them. Unfortunately, 18 or so died in exchange of fire with police. So we knew there is a syndicate, but we didn't know this syndicate had cover, as explained by Lieutenant General Mkhwanazi, that they have cover either from the political front or cover from law enforcement agencies or the judiciary. And that's the element that we really believe that let's appreciate it, prepare and provide information that is at our disposal. And I think the Commission will assist us to know who's responsible or behind these things, who's trying to defeat the good work that we're trying to do.
So as the province, you are going to cooperate with the Commission and provide them with whatever information they need. You won't be initiating your own investigation.
I think it will be a waste of resources for now, because there are two processes that have been instituted, the parliamentary process as well as the Commission of Inquiry. So I think let's channel all our resources there, because I think they've got the power to subpoena, and they also have the power to conclude their reports, as the President indicated, either a preliminary report within 3 months and a final report within 6 months. I mean, we've just finalized our Gampepe commission in the province, so they take long. So we'll rather have and put the resources and focus to the current commission that the President has announced.
Yeah. We had a conversation at the start of the show about what Operation Dudula has been doing, trying to block access to healthcare from particularly illegal immigrants. Is that a big concern for you?
It is.
As the Premier here in the province?
I'm of the strong view that we have either mismanaged or delayed to deal with the issue of undocumented citizens. And I don't think that we can resolve it by either closing clinics or chasing away and other things. We need to dive deep to the problems. How, as a country, we have to respond to this matter. And I don't think that we have put the necessary energy on this particular matter. It's a serious problem. And Gauteng, we are the bearers of these huge numbers, purely because of our economic position. So to think that we can resolve it by chasing people from either clinics or other areas, I don't think is a correct approach. That's an approach that it's a symptom. We have to dig deeper, dive deeper to this problem and attend to it. And as a province, we've identified it as a key problems, because it affects our budget, it affects our planning, it affects our infrastructure. And unfortunately, also, in some instances, if not most instances, it has an element of crime as well. So we are the bearers of this unfortunate matter. So we are calling on national government, and we are also calling on all law enforcement agencies. Let's find a mechanism to manage it. We are proud that the border management agency that has been established, at least it has started to put a dent there. We just have to deal with documentation, and we just have to deal with identification. We frown upon people that are in our country that we don't know who they are, where they stay, how they came here, what are they doing on a daily basis, and they're just roaming around our province. We really believe it's a situation that must not be tolerated nor encouraged, and we need to find an everlasting solution. Piecemeal solutions that are currently being deposited in the public space, I really believe that are not going to assist us.
And without a proper solution, we're looking at a ticking time bomb here.
It is.
I mean, the minister in the presidency just the other day spoke about the redacted national security strategy, which was warning that the uncontrolled movement of refugees and asylum seekers can trigger, among others, acts of terror. I mean, if we're not addressing this, we don't know what we're going to be dealing with in the future.
Indeed. It's a big problem. I mean, I went to one informal settlement in Mzwandile. I've never, 75% or so of people that are staying there, that don't have documents, don't have the right to be in our country, and are there. And they've got what we call parallel government system. They run their own electricity system, their own water system, and they also run their own security system. And we can't tolerate that. I mean, if we're...
How are they allowed to just set up homes like that?
Purely because, as I said, they've managed to bypass the system, basically. And that's the reason why they're in the country. And then that's the reason why they can offer those alternative services that need to be provided by government. So that is what I'm saying. If you are going to tackle it in that piecemeal attitude, I don't think we'll win. It is a problem, and all of us, I think, accept it is a problem, and all of us concurs. You can't have people that you don't know in our country. You can't even have people that you don't have their documents, you don't have their records, we don't have their fingerprints, you don't even know who they are roaming around. That's extremely dangerous. And I'm glad that National has characterized it in that particular fashion. But we need to move with speed to tackle it. Unfortunately, we have to take unpopular decisions. And we have to liaise with those that we believe that can assist us to work with, which is our neighboring countries and other institutions that they need to accept that it has reached a stage in which it can be managed through normal legal frameworks, that we need an extra abnormal approach to manage it and to deal with it and to resolve it finally. Or else we're going to really plunge our country into a serious disaster.
Gauteng Premier Panyaza Lesufi, thank you so much for speaking to us.
Thanks for accommodating us. Truly
and thanks to
appreciate
you for watching the Thursday edition of Face the Nation. We'll be back with you on Tuesday at 8 p.m. Thanks for watching. Cheers.